Hi, everyone. My name is Mandy Arceneaux, and I am the Associate Director of Marketing Relations for Lamar University, as well as the Marketing Manager for the College of Education and Human Development. This morning, we are here to have a major discussion of health within the Department of Health and Kinesiology. Our goal is to answer questions as they relate to being a health student here at Lamar. Our guests today are Dr. Chillick, who is the department chair, as well as Dr. Masingi, who is an associate professor. Also joining us is Brianna Scott, who is an admissions counselor here at Lamar University. She and I will be fielding any questions that may come in from prospective students, so just be mindful of that. Also, just so you know, your video is turned off and your mics are muted to ensure your privacy. You can ask questions using the chat option at the bottom of your screen, and we'll do our absolute best to make sure we cover those during our time together. We are recording the session and posting it on our website, and the recording will also be closed captioned, so that will be taken care of. I believe we have an interpreter with us as well. Nope, no interpreter here today. Okay, well, we will do our best to continue on and get that taken care of as we continue. Dr. Chillick, let's go ahead and get started. I'll turn it over to you if you'll tell us a little bit about who you are, what you do, and everything we should know about the department and specifically health.
Okay, I'm Dr. Daniel Chillick. I am the department chair for health kinesiology. And I came here as a faculty member in 2001. So I've been here for a little while. I came here to actually bring in the exercise science degree. Prior to that, I was actually here in 1982 as an undergraduate student and a baseball player. So I have some history with Lamar. 2 years ago, I took over the chair's position, and we are working on our programs, and we did all of last year. So prior to this fall, we ran a community health program. We actually run 3 undergraduate programs. The community health was a broad-based health program that looked a lot at nonprofits and clinical settings. We have made that more specific, looking at marketability, and changed that. So the fall program is a public health program in healthcare administration. It's timely, despite the fact that we had Corona happen, which is going to really ramp up healthcare. The job opportunities are going to expand greatly in this area now. That was already happening, which is why we made the change. But it's going to become more essential now as we move through this epidemic. So we are going to talk to you mainly about that this morning, but I want to tell you about our other programs. We also do have an exercise science program, which is a pre-professional program for pre-graduate programs in physical therapy, occupational therapy, pre-med, pre-physician assistant, and on the flip side, it also does the personal training, sport-specific training, and sport medicine, athletic training. And our third program, that's an undergraduate program, is our PETE program, our Physical Education Teachers Program. It is a EC through 12 certification program, and now expanded into a non-cert program to satisfy those people who want to go out and do sport-specific training, like youth sport training. There's a lot of those facilities that have popped up for baseball, basketball, and all those different sport genres, plus just speed and agility training. So it's to help satisfy those things. Those are our 3 undergrads. We have 2 master's programs, and in conjunction with our public health now, we also have a master's of public health, which your public health degree would prepare you to go into. That opens other doors for you. We also put in our major a business minor, so you could get an MBA coming out of your program, or they have a healthcare administration master's in business. It should prepare you for any of those if you would want to continue your programs. As far as the department, that's the nature of what we offer. And so I want to let Dr. Masingi, who is our coordinator for public health for the undergrad, excuse me, for the undergrad programs, speak to you a little bit about the opportunities that are going to be present as far as jobs and other opportunities that will come up with the program. So Dr. Masingi.
Hello, everyone. My name is Dr. Masingi, an associate professor of community and public health, and my area of interest as far as research and so on is environmental health, and conduct research mainly on obesogenic environmental factors that lead to obesity. I teach numerous courses in the department, including health and wellness, contemporary health, health disparities, and so on. That is in the undergraduate level, but also at the master's level or graduate level, I teach several courses that includes environmental health, biostatistics, health literacy, and program planning. As the department chair stated earlier, I'm currently the coordinator of the health program, and that mainly involves student advisement and curriculum improvement, and also assisting the department chair with schedule building and any other assignments that the department chair may provide to me. Basically, coming back to the health degree, the Bachelor's of Science in Public Health with a concentration in healthcare administration, the degree is generally geared towards students who are interested in pursuing a career in business operations of medical facilities, for example, or city, county, state, federal health, administrative activities. It also geared to students who are interested in working in private businesses or nonprofit organizations. Students basically who are interested, who are seeking, for example, to pursue good career opportunities in, for example, the medical field. This would be their great degree of choice. This degree basically prepares students to manage finances, for example, human resources, and daily operations of, for example, hospitals, clinics, nursing homes, and other related organizations. So basically, students in this degree are introduced to the fundamentals, for example, of business, as well as theories and practices that apply in healthcare organizations. So during the course of study, students have the opportunity to develop skills and knowledge that assist them in understanding the organization of employees, for example, managing employees, human resources in healthcare facilities. And this program basically will culminate with the students completing a public health capstone project. And this project basically is intended to expose the students to real world skills experience where they can explore various topics and how basically they can be able to work in real world environment. This degree is usually accredited degree. It's accredited by regional and national well-known and accredited agencies, and this accreditation process is an extensive evaluation process that is carried out to ensure that after the process is completed and the degree is approved, basically the offering of this degree is regarded as of high quality and meets the national as well as international standards. So going back to the type of opportunities that can be available with this degree, job opportunities can be available in different settings. For example, the healthcare setting. And this means Students who graduate from this degree can work in hospital settings. They can also work in other facilities, for example, diabetes education centers or dialysis center, hospice home, and urgent care and things like that. But also graduates from this degree, they are able also to work in city, county, and state or federal health departments and so on. But also students can work in private businesses and nonprofit agencies and so on. So these are the main settings. Most students usually they come up with a question asking, oh, what kind of jobs can I get from this degree? As the department chair stated earlier, this degree is going to open a lot of opportunities. To just mention a very few, there are actually a few job titles that I can mention. For example, health service administrator, that's one of the job title that a student that graduates from this degree can be hired into. There is also, for example, a school public health administrator, or they can, a student can become a public health analyst or a prevention health coordinator, public health coordinator, administrative specialists and things like that. So these are the types of titles in which students who graduate from this degree can be hired into. Now, responsibilities from these employments are generally the ones that are well known as far as administrators or administrative functions is concerned. For example, it involves, for example, daily operations for policy formulation in these medical facilities, or managing employees, salaries, and so on and so forth. So these are some of the examples of assignments or responsibilities that go along with the type of jobs that a student who graduates from this degree can get. Now, apart from the job opportunities, also in our department, there are a number of other opportunities. For example, we do have a study abroad program that our students can participate in. And also we do have student organizations. As far as regarding the study abroad program, we have taken our students, for example, to South America and Ecuador, and also we've taken our students to Mexico. For example, in Ecuador, our students participated in learning about health disparities, learning about healthcare systems, and also having the time to explore about alternative medicine and things like that. So it is a great opportunity for students in our department, for example, to learn different cross-cultural health-related matters. And for example, in Ecuador, our students had the opportunity, of course, to compare the health delivery systems, looking at population health and comparing between the affluent and the less affluent population, and looking at the accessibility to healthcare services and things like that. So there are a number of benefits, of course, a student that participates in a study abroad program. One of that is, of course, the cultural immersion as well as the exposure. But in addition to that, of course, students get the opportunity to learn from one another. You also have hands-on learning experience by actually participating in, for example, since we go into hospitals, healthcare facilities, and things like that, for our students to shadow working with doctors and nursing to try to learn exactly what's going on as far as health is concerned. But again, I think it's a good career, future career decision opportunity. It can help students, make a good decision as far as determining their careers in the future. Students, for example, may decide to participate, for example, in Peace Corps organization or working with USAID. So that is, an opportunity where students can expand their horizon and things like that. But in addition to that, I mentioned about the organizations, student organization in our program. We have, for example, the Health and the Environmental Education Corps. This is a student organization in which I advise or supervise. And we also have the Eta Sigma Gamma, that is the advisor is our colleague, Dr. Hernandez. The Health and Environmental Education Corps, basically its goal is to train students to be able to plan and deliver appropriate health and environmental education programs in our community, but also students get the opportunity to learn how to conduct research. And beyond that, students are able from that research to be able to analyze data, to write reports, and as well as present in conferences. But these reports, since they are research based, then our students have the opportunity to go through the process of publishing that. So we have done some publication from students who participate in this student organization. So those are some of the opportunities that are available in our department. So I'll stop from there, and if there are some questions or things I need to clarify, then I can do so.
Thank you. I think you touched on a lot. You touched on study abroad opportunities, the hands-on experiences that students can have as a health student here at Lamar University, and the student organizations. I think students are always looking for ways to get involved to maximize their college experience. So I do appreciate you touching on that and opportunities like that for students. I did want to ask you a question about what a first-year class schedule would look like. Would freshmen take health related classes their first year? Is it, can you speak on that a little bit?
Yes, the first freshmen, they have the opportunity to take a couple of our courses. Basically, the first semester, our students are able to take, for example, health and wellness. So that is, students are able to take along with the other general education requirement courses. Now, on the second semester as well, the students will be able to take an additional health course, for example, the foundations of health. And so these are the two courses that are advised or are recommended for our freshmen to take on their first year.
Awesome. Okay, that's good to know. Something else that students may be wondering, we've talked a lot about the undergrad health degree and all the benefits that offers and all the job opportunities that opens up. But Dr. Schillick also talked about the master's program in public health that we have. And I think a lot of students may be interested in what opportunities what additional opportunities would open up for students who continue on at Lamar to get their master's in public health versus just their undergrad. Can you speak to maybe the importance of that connection if students are interested in that and what that would open up versus just having their undergrad in health?
Yeah, basically this degree is geared to preparing students not only to end with the undergrad degree, but it is a good opportunity to connect to advanced degrees, for example, at the graduate level. We have a plan to make a 3 by 2 degree opportunity where students will be able to complete their undergrad degree within 3 years, but also be able to continue with our MPH program within 2 years. So that cuts the time where a student will be able to acquire their undergrad degree as well as their master's program. So this degree actually will open doors from going to further taking, for example, graduate level degrees, MPH, for example, students who may desire, for example, to take a master's in the same field, healthcare administration, they can do so. Or if they want to transition to go into becoming or studying to become physician assistants, and many other fields of education. So this degree basically will prepare students to be able to access such opportunities.
Great. Sorry, Dr.
I would add to that public health is a huge profession. It's not just a medical profession. So in our MPH right now, we have people who are working in the water department because that's a health related area. So it opens doors beyond things you might commonly think of as just being in the health settings, the medical settings, because there's a lot of, and we're learning this now with this coronavirus, that there's a lot of essential services that are health related services, from physical to mental to a lot of different things. We're learning that we can now do a lot of the doctor's appointments online. And that's going to be, and we're doing some of that already, but that's going to open up another genre in this where we're going to have to set up security, billing, all the things that are necessary to administrate and keep people's information private, even though we're sharing it with them. So there's going to be a lot of different opportunities, and the master's opens up at your undergraduate will open a lot of those doors as well.
Yeah, thank you for touching on that. I know as we've all lived through this pandemic, that knowledge is power, right? And so a lot of they're learning new things about this every day. And so that's why I wanted to talk about that continuation into the master's program. And I know Dr. Masingi mentioned that eventually we may have a 3-2, which I believe means you would have 3 years in your undergrad and then 2 additional years to get your master's. Is that right?
Yes.
See, that's really good to know for future students who want to pursue a degree in health, and knowing that those opportunities are coming for them here at Lamar University. I think the last thing that I'd like to touch on is maybe the classroom environment. You know, are they big classes? Are they small classes? Do you really have the opportunity to connect with professors? Can someone speak to maybe what the classroom environment looks like?
I'll let you start, Israel.
Oh, okay. Our classes really, we can call them large classes, because really the average class size is about 35 students per class for undergraduate level. So that is the average class size. So this is a very good class size where students get a lot of opportunities to interact with our students, with their professors. And one-on-one time to be able to solve any issues that may be related to academic and things like that. So it's not large class sizes. And so the other thing is that maybe we didn't mention is that this degree is fully online, and therefore being online, this opens a great opportunity for students to be able to take classes and be able to manage their time very well. So students who want, for example, to come on campus, they can do so, but mainly they can be able to really take this degree from anywhere they are. So that, I think, is a very great thing to have in our degree.
And from the perspective of our university, we're mid-sized. We have about 15,000 students. Our major product is our students. That's where we put our efforts. Your advisors will be Dr. Masingi, Dr. Hernandez, We have your instructors also be your advisors in all our programs. We take a very hands-on approach. We've done this online because it opens a great deal of opportunities. If students want to be in Houston's, where there's a lot of different opportunities, or Dallas, they can be taking our program and have expanded opportunities that we may not have in our area. And so this is part of our putting this online, is that we want to be able to service people, and not only that, give them expanded opportunities where fields of market may be larger than the market we have here. And so we're always, the center point of everything we do is our students. They are our products, and we're going to try to make sure we're doing the best that we can in every way possible for them.
Absolutely. And I'm glad we talked about this being an online program, as it seems like everything has gone online these days. Students may have a little bit of nerves when it comes to taking online classes, especially if they're fresh out of high school going into college. You know, they've been in the classroom, that's all they know. And so transitioning to an online classroom may be a little bit intimidating. What's a good piece of advice that you have for students who are looking at this program, but maybe a little nervous about it being fully online?
What I can say from my experience is that, you know, students have to have, you know, that skill of good time management. They have to be really self-motivated and, you know, self-driven to be able to actually operate or function online. So that is the main thing that students really need to be able to do. You know, apart from the other advantages of being able to do this or to take classes from wherever they are, of course, time management and being self-motivated, those are key things that will be able to help students, you know, do well in an online course environment. And the other thing is that, you know, our courses are structured and they are they are well designed to allow students to get as much information as possible just from accessing those on Blackboard. That is our medium of instruction. We use Blackboard for that. And they are quality matter approved or certified. So they are courses that students will be able to have the opportunity to get everything that they need from the course, but also time to interact with the instructor on one-on-one basis or as a whole class.
And I think I'd add to that, that look, the philosophy would be treat it like it's a normal class. A normal class is either meet twice a week or 3 times a week. And if you're online doing your work on a regular schedule, because the courses are organized and they are structured, they're dated, have all the things that keep you in progress. So if you're regularly communicating and working online, it's just like you're going to class. There's no difference. You just don't have to come to our physical building to do it. And that's the biggest issue, I think. You have to stay in contact and structure your life so it's just like going to a regular class.
Yeah, thank y'all both for touching on that. I know as an online student myself, the biggest thing that I've just learned to do is to show up, right? Log in, get involved, and don't be afraid to email the professor or message the professor through the medium of instruction, because they want that. The instructors want to connect with you, even though you may not be face-to-face. They want to get to know you like you are face-to-face. So I think doing everything that you said, treating it like a regular class. I know I log in every day just to make sure I don't miss anything, to make sure I'm on top of everything and I'm aware of what's coming up. That's the best thing I love about online education, right? Is you can almost look ahead, you can review the syllabus, you can see what's coming and be mentally prepared for what's expected of you as an online student. That is really all the questions I think we have today. Is there any final points that either of you would like to make?
Well, as I said, I think it's important, or the thing that we try to sell the most is that we are student oriented. There are a lot of good institutions out there. I got my degree, my PhD at Texas A&M, which is a wonderful institution. but they can't do the same things there that we can do with our students because of numbers. And so, and we realize that. That's our selling point. We can provide things for our students because of numbers that they can't. And so that is our objective. We're at a size where we're able to do that and make sure that we're providing the best opportunities for our students. So, and our education is second to none.
Any final thoughts, Dr. Masingi?
One thing that I did not mention, basically, I received a lot of questions from students regarding what is likely to be the salary range from, you know, if I get an employment opportunity from this degree. So briefly, I would say, you know, basically salaries vary by location, by the employer and experience. But for example, the median salary for a medical and health service manager is around 84,000. And if you look at healthcare administrator, median salary is about 91,000. For an administrative medical assistance is around, you know, 40,000 and above, you know, something like that. So I think, you know, that is not, you know, a bad, you know, position as far as salary is concerned. So yeah, that one thing I wanted to mention regarding, I get a lot of questions from students about that.
Sure, rightfully so. Thank you so much for touching base on that. Well, if we don't have any additional questions, I do want to thank both of you, Dr. Chillick and Dr. Masingi, for being here today. Also, a big thank you to Brianna Scott, our admission counselor, for taking time to be with us as well. I do want to share my contact information with you should you have any additional questions for people watching us. If you want to touch base with me at any given time, you absolutely can. Here you should be able to see my name, Mandy Arceneaux, as well as my email address, aldowden@lamar.edu. That's aldowden@lamar.edu. You're welcome to contact me via email anytime so I can answer any questions that you have, get you in contact with any faculty members that you may want to visit with as well. Also, you can always visit our college website, lamar.edu/education. That's lamar.edu/education. You can go there, view all of the programs that we offer within the college here at Lamar University and get even more information about the health programs there. Also, you can visit lamar.edu/visit. That's lamar.edu/visit to learn on ways that you can engage with Lamar University during the pandemic and any other time for that matter. So those are two good internet resources for you as well. So thank you again, everyone, for being here. We really appreciate your time and we hope you have a great day. Thank you.
Thank you.
Bye-bye.